You know, in the world of healthcare, there's a promise that's made, often without a single word ever being said. It's the absolute foundation of trust, a pillar of care. But what happens when that unspoken promise is broken? Let's dive into what happens when that sacred trust gets shattered. Just think about it for a second. Imagine all that information you share in what you think is the safety of a doctor's office suddenly becomes public knowledge. This isn't just some hypothetical question. For some people, it's a shocking and painful reality. So picture this. A woman steps into a crowded hospital elevator. Her mind is completely on her husband, who's a patient upstairs. Then she overhears two staff members chatting. And with that sickening lurch in your stomach, she realizes they're talking about him, his case, his illness, his private results, just casually discussed between floors. That moment in the elevator, it's so much more than just some awkward gossip. It's a fundamental breach of trust. It's a violation of a patient's most basic rights. I mean, it strikes at the very heart of the entire patient-provider relationship. What was actually shattered in that elevator has a name. It's called medical confidentiality. And it's not just a nice-to-have guideline. It's the ethical backbone of healthcare. It's the promise that a patient's most private information is going to be fiercely protected. Now look at the wording here. It's not a suggestion, it's a duty. For every single medical professional, this is an active, ongoing responsibility to safeguard what's shared with them in confidence. And for every patient, it's a right you are absolutely owed. So, how are these conversations supposed to happen? Well, the rules are incredibly clear. First up, you've got to have the patient's consent, whether it's spelled out or at least implicitly understood. Second, the only reason for the discussion has to be for the patient's benefit. And third, it can only be with people who are directly involved in that patient's care. That's it. And following these rules isn't just about avoiding lawsuits or some uncomfortable elevator ride. It's about upholding a principle that has huge consequences for patient care and, honestly, for the reputation of the entire healthcare system. I think a lot of us just assume our health information is a totally private conversation between us and our doctor. But the reality of modern healthcare, it's way more complex, and frankly, it's a little startling. Okay, get ready for this. During a pretty typical course of care, a patient can expect their personal records to be seen by 75 different healthcare professionals. Yeah, 75. Just let that sink in for a moment. That is a massive circle of people with access to your most deeply personal information. And it doesn't even stop there. The circle gets even wider. You've got insurance companies, government agencies who might have legal access. You have database administrators who manage the whole system. And then, of course, you've got the illegal threats, like computer hackers. This really shows why every single person in that chain of command has to be so vigilant. And here's the payoff for getting it right. Just look at this. When patients feel their information is safe, their trust just skyrockets. And that high level of trust, it leads directly to better patient cooperation, which, of course, leads to better health outcomes. It's this powerful, positive feedback loop that helps everyone. And, as you can see, it boosts the institution's reputation right to the very top. Okay, so we get the why. Now, let's get practical. How do we actually put this into practice? What are the simple, actionable rules for protecting patient information day in and day out? First off, let's talk location. This might seem like a no-brainer, but clearly after that elevator story, it has to be said. The only place for these discussions is in a safe, private zone. The danger zones? Well, they're pretty much everywhere else. Elevators, staff lounges, even dinner parties with your colleagues. Next up is the what. Put yourself in the patient's shoes. Do you want the medical team chatting about your personal habits, your family drama, or your problems at work? Unless those things are directly, and I mean directly, relevant to your treatment, they are completely off limits. They're just not part of the professional conversation. So, this is a really crucial point. Professionals have to actively fight that urge to pry. Simple curiosity is never, ever a good enough reason to ask a patient for embarrassing or medically unnecessary details. It's all about maintaining those professional boundaries. Okay, I know. After all these rules and examples, it can feel like a lot to remember. It can feel like a minefield. But really, it all boils down to one simple, incredibly powerful guiding principle. This is it. This is the one rule to rule them all. If you walk away with just one thing, let it be this. You just have to ask, Is this person actually designated to help this specific patient? If the answer is no, the conversation stops, right then and there. It's the ultimate litmus test for confidentiality. And that leaves us with this final, massive question. In today's world of electronic records, team-based care, and constant data sharing, how do we, as both patients and as professionals, make sure that this fundamental promise of trust remains the absolute bedrock of care?